And we are finally live. Technology was showing me all the flames they could possibly show me. So let me wait for some people to hop on and drink some water to, minimize the absolute almost stressful situation we were in. I'm gonna wait for some people to join in, and then can I have a thumbs up if you can hear or see me? I know the background is very different today. Technology has been very interesting, so we've been trying to adjust as much as we can so that this conversation can happen as seamlessly as it possibly can. All right, let's see. Oh, the time. Let's hope people join in. I don't know how the time is people are, but we are here now. Let me do this quickly. Oh, thank you so much. Can I have a thumbs up if you can hear or see me? Whoever just joined. Hi, hello, everybody. Hello, 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 and welcome, 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 welcome. Firstly, I think I need to say a little prayer to ask just God to give us the strength to really have a fruitful conversation. Been getting, very, very different vibes. It's been a struggle for us to have this conversation, but it's finally happening. Can I get a thumbs up from everyone? In the interim, I think I'll just continue. Welcome to our third conversation on the untold stories of a miscarriage. And here we try and normalize one of the most normal things that happens to 1 in 4 women. That's the shocking statistic of how many people miscarry. And this conversation is happening because when I announced that I had lost a child, I heard stories from people I knew, people I've spoken to, but people I've never even realized that they went through a loss like that, because it's one of the most loneliest journeys you can go through. And this is what we are trying to normalize, to have continued conversations around this subject. So today I have a midwife with us, Sister Nonhlanhla. I'll share a brief story about Sister Nonhlanhla. She was the midwife with the gynae that I use. I don't know if I've ever told you this, actually. Sister Nonhlanhla, I'll introduce her just now, but we've really had her as our in-house expert whenever we'd have conversations regarding childbirth and pregnancy. We've had a conversation with her and an ask a parent conversation about conceiving vaginally. And I'm really excited to be having this conversation with her. Ladies and gentlemen, please help me welcome Sister Nonhlanhla. Hello.
Hello.
How are you?
Yes, Karabo.
We are doing this. It's happening. It's really happening.
Oh, yes. Let's do this.
Alina Mashaba says, I can hear you but can't see you clearly. I wonder if that's just a YouTube problem. I wonder if the people who are watching on Facebook are having the same issue. Someone please tell me something, because I don't want to continue with the conversation if we're still struggling with technology, because I would like people to hear and see us as best as possible. So how's the reception for everybody else that's watching? There's a couple of people watching, so please tell me how we are doing. In the meantime, I'm still gonna say in the meantime so that we don't just wait. Thank you, Sister Nonhlanhla, for agreeing to have this conversation with me. Maybe let me start there. I always like getting my guests off guard a little bit. Why? Because it was an openness from you when I asked you to have this conversation with me. We didn't have like a back and forth. Why did you think this was a conversation that Sister Nonhlanhla could be a part of, particularly within your profession?
Okay, Karabo. First of all, thank you, and I'd like to welcome all the viewers that are watching us as well. Miscarriage for me is a very painful topic. I have seen a lot of ladies go through it, and I think when I was working with the doctor that you were mentioning earlier, to say we met through him. Yes, I saw a lot of ladies go through this journey, and it's one of the most painful journey that a woman can go through, and as well as couples go through. And a lot of the times it's something that is banked and not spoken about, because one is fears being judged. You know, in our Black society, you are labeled if you can't have a baby and all of that. And because it's such a very sore topic, I felt, why not do it? Why not talk about it and just let women out there know that it is not your fault? You know, a lot of the times it's not something that you can prevent from happening. It's something that will happen and catches you off guard, and we need to talk about it. A lot of ladies need to know that, you know, there is help, and in terms of preparation and all of that, there's nothing much that one can do to prepare, but it's one of those things that will happen unexpectedly so, and it's not your fault.
And we are honored to have you, to have a professional. I think I wanted to add a voice of a professional in the space, because I've been talking to parents, and I've been talking to women that have gone through this, but I thought your perspective would be so important, because then we could understand that it's one thing that is beyond our control.
Yes.
And I think that
very much.
that is so. I want to briefly share about my experience, right? So I miscarried before I found out how far I was. So it's been quite an interesting journey to go through. So I knew I was pregnant. I didn't know how far I was, and I had pains for about 2 days before I started having the physical, reactions of what happens to a woman that miscarries. So I got the cramps a little bit, and because I didn't know how far I was, I know some cramping is normal in the first few weeks of pregnancy. Exactly, the first trimester, you cramp now and again. So I didn't immediately get worried. The only time I got worried is when I woke up that day. I was busy in the morning and I went to the bathroom. I was still crampy, and then I went to the bathroom, and then when I wiped, I saw small traces of blood, and I remember thinking, man, this is not supposed to be happening, because as much as I didn't know how far I was, I knew I wasn't that early to be still going through implantation bleeding. Like a part of me, I was past that point. So I was like, no, this is not supposed to be happening. That's when I started. I spoke to my best friend's mom, who used to be a nurse, and I was like, this is happening, because I was very confused. I was like, this is happening. I don't know what I'm supposed to do. And she's like, no, but not in a panicky way. She's a nurse, she's probably experienced this before, so she was very calm, very calm.
Yeah.
I was like, just go to the doctor, and then I called in to get an emergency appointment from the doctor, and they were able to fit me in. And I got there, and I sat there for about 2 hours in the waiting area, and then I was so crampy. Like, there's a point where I was sleeping on like by the waiting area, because the cramping was. I felt like I was in labor. Like it felt like contractions. And they would give me a bit of a break to relax. But then it kept coming, and it was so. And by that time, I wasn't really bleeding. Like, I was just like a bit of traces, blood traces. And then when I finally saw the doctor, the guy did the scan, and then he said something is definitely wrong. And that's the point where my world got started. And he introduced a very new concept to me and said this was a missed miscarriage. And a part of me carried that guilt for a while, because I'm like, that means I missed it. How can I miss it? So I wanted the conversation to be around that, because I mean, I'm a woman that has carried a child before, but I didn't even know that you can miss a miscarriage, you know. And I think it's that we're not having enough conversation and raising enough awareness about this stuff. And when we're raising awareness, it doesn't mean we are saying people will go through it or we are hoping people do go through it. We're just raising awareness that 1 in 4, there's 1 in
Yes.
4. So this is a one
That will
thing we
experience.
should be familiar with and need to know how to navigate should it happen to me, because I never thought it would happen to me. I was always writing about the subject, and one day it did, and it shut down my world. So what other type what have you found was the most predominant type of miscarriage that a lot of women have in your line of work? Because you said it's been a lot, so chat to us about that.
Okay, Karabo. In your case, yes, it was a missed miscarriage, and a lot of missed miscarriages will happen where the fetus stops growing, and you miss it in a sense that there's not much that you can do. There's no signs, visible signs that you're pregnant where the baby is kicking or anything like that that would tell you that now this baby has stopped moving, stopped living, and that's why it's, you know, voiced out as a missed miscarriage, because now it's something that everybody misses. We didn't see it. We didn't know it was coming, and it happens like that. A lot of ladies would present with vaginal spotting, where it's bleeding that will come in trickles, or a brownish discharge to indicate that, you know what, it's been a while that this baby has not lived, so now the body is trying to get rid of the pregnancy, and that's why you had the cramping and all of that. The cramping, yes, feel like you are in labor because your body is trying to, you know, expel the product of conception, of course. And there are different types. We actually have about 6, with missed miscarriage being one of them. And then we have a threatened miscarriage or a threatened abortion, like, you know, some medical professionals would call it, or some textbooks would call it. And with your threatened miscarriage as well, the lady would present with a little bit of vaginal bleeding, and a lot of times when we support the lady with, you know, pills to help relax the uterus, a little bit of bed rest and all of that, you find that this pregnancy can be preserved and it continues, and the mother finally has the baby. But in other cases, the threatened miscarriage can actually, you know, move from that stage of threatened to your complete type of miscarriage, whereby all products of conception are now expelled out, where the woman experiences a lot more of the bleeding, as well as abdominal cramps that will come, and they are quite painful. You know, I always tell people, if you have very bad period pains, labor actually feels like very bad period pains. So you would experience pain to that extent. And then you have your inevitable, which is one that cannot be stopped. So this is like your threatened that, you know, progresses, and then it gets worse and you bleed and eventually everything comes out. And then you have your incomplete miscarriage, where a part of, you know, product of conception will come out, and you still have the cramping, a little bit of bleeding that can proceed for about a week, depending on how quick, you know, one makes advances in terms of getting medical attention. And this one now, this is where, you know, the medical professionals would say, let's go to theater and do what we call a DNC, or we would do an MVA. A DNC, it's dilatation and evacuation. So basically they're cleaning the womb, and or an MVA, this is the manual evacuation of the uterus, which can be done in the rooms where you are consulting your healthcare professional. And then you have your recurrent miscarriages as well, where a woman experiences more than 2-3 times of miscarriages. And then with this one, we tend to say proper investigation needs to be done so that we can see where the problem lies, so that we can be able to, you know, preserve subsequent pregnancies that can follow up. And those ladies are normally encouraged to see a medical professional the minute they know that they are pregnant, so that, you know, proper interventions can be put into place to try and preserve the pregnancy.
Yeah. So I want to ask about a threatened miscarriage, right? So
yes.
When I was talking to you know, gynaes and professionals, there's an explanation to say we actually don't know what causes a miscarriage. I think one of the nurses on site on the day was trying to say, you know what, maybe there was going to be something wrong with the child. You know, science about chromosomes and all of that stuff. But then what causes a threatened miscarriage? Is there something wrong with the child who's threatening to expel or stop living, or is there something wrong with the mother's body? And because that's the only one you can control, but all the other ones you can't. So what leads to a miscarriage?
Okay, so your question in terms of threatened miscarriage. With a threatened miscarriage, it's not anything wrong with the baby, nor anything wrong with the mother. It is an unstable pregnancy. So it's just an unstable pregnancy where some people would present with an ovarian cyst. So with an ovarian cyst or people that have got uterine fibroids, you know, those are people that will experience a threatened miscarriage because the baby and this fibroid are fighting for space in this small uterus, and that is why we're having that. So a lot of the times support is offered and medication that can try and, you know, calm the uterus, and, you know, we boost the mother's progesterone levels as well and try and preserve the pregnancy.
Okay. And how long do women like that go on bed rest for? Because like we ask them to slow down, right? Slowing down helps.
Yes, but it's a tricky one, hey? Because we are working individuals. So you can't tell one to say be on bed rest for the rest of the pregnancy. It gets to be impossible for you to do that. So a lot of the times we'd say about a week or so and see if the pregnancy would still be unstable after that. So this is women that will be seeing the doctor almost every second week to make sure that the pregnancy is continuing well until such time that we can say, no, now we are in the safe zone. You can go back to normal.
But do you ever have cases where a threatened miscarriage just becomes a complete miscarriage? Are there cases where you can't say?
Yes, we do experience that, where you find that, yes, treatment was implemented, you know, bed rest was implemented, but all that doesn't work, and eventually the lady loses the pregnancy. And yeah, it's a painful thing, but yes, it does happen.
So Karabo, and I just found out I had a miscarriage, and I want to know what went wrong. Are there tests that you guys can run to actually give me a proper scientific explanation to say chromosome A and B and Z were not working, and this is what led to the loss?
Okay, so yes, Karabo, a lot of the times when people present with your miscarriage, your incomplete miscarriage, these are people that will be taken into theater, or a manual evacuation will be done where the womb is cleaned, and those products of conception are taken and sent to the lab for what we call a histology. So histology will come back and tell us, no, there was something wrong with the baby, or actually there was nothing wrong. It was just going to happen. So there's cases where even though investigations were done, we still don't have a scientific reason why it happened.
Sure. Do you think it's because there's no reason, or there hasn't been enough time for science to really pin on like a reason why they don't happen?
On that one, Karabo, you know, I don't have your concrete answer to that to say, you know, maybe with time, eventually we will be able to find out. Take, for example, a woman that experiences your recurrent miscarriages. We try and find out to say, okay, recurrent miscarriages, blood tests will be done on mom, you know, to investigate what could be the cause in terms of her body and how it works. And with the miscarriages themselves, we send to the lab to say what could be causing these miscarriages, and then we take it from there. You know, so in terms of that, probably eventually we will have more reasons why miscarriages happen, but some just happen and nobody has an accurate answer to give to an individual. Yeah,
makes sense. So as someone like me that that miscarried at home? Because I understand like a lot of the losses can take place, and it becomes an incomplete one, and like your body just
Yes.
needs to do what. Because it's the same for me. Like I completed the rest of my miscarriage in a hospital because I was passing out at home from all the blood I was losing. But then if a bulk of the bleeding happened from home, are you able to still run tests? If all the clots that happened were flushed down or whatever, are there still tests that you can run by taking blood tests from me, or do you need some of the clots to be able to investigate properly?
Yes. A lot of the times we need the product of conception, which is the clots that you're referring to, for them to be taken, because there's actually tissue that is there that can be investigated from the clots. So if you have bled out, unfortunately, there is nothing that we can, investigate on. So it's a process of waiting to see with your next pregnancy what happens, and then we take it from there.
Yeah, and it's such a complex one.
It's a painful one, really. There were times when I'd find myself in a situation where you are actually literally crying with the client because you don't also have an answer to their questions as to why it happened. And I think the biggest thing for ladies is blaming themselves to say, maybe I could have done something to preserve the pregnancy. Maybe I could have. And a lot of the times it's beyond anyone's control.
Yeah, and I think that you're right. That's exactly why it becomes such a hard process, because for one, it catches you off guard, and for secondly, you have all these questions about what just happened, because it also can happen so quickly, like 24 hours, and then it's done, and it's like, wait, I was pregnant yesterday, I'm not pregnant anymore, and you have all these questions, and sadly, no one can give you answers to them. That's what makes it such a difficult process for me. So again, Karabo, I just went to the gynae, and the gynae said there's no heartbeat. The baby has stopped living. What are my options? What's next? Because for me, and I'm asking this because for me, I didn't know what came next. I think also, I mean, the gynaes have probably seen this so many times, and I was in proper shock. I didn't have questions for him. I didn't have anything. Like I was just dumbfounded. What do you say to a woman like that as they're heading home? What should they have? How should they prepare for what's about to happen? Because something was about to happen. Like I started bleeding from the hospital rooms, and one of the midwives came and helped me out with a pad because I didn't have one. So I got a pad from her, and then I didn't know what. Just said, just buy a packet of maternity pads, and that was it. But how do you advise women to prepare for what's about to come?
Okay. It all depends on each and every case and how it presents. But a lot of the times it's more supportive care that you can offer the woman than anything. So firstly, I would take you through the whole process to say, okay, this is what has happened now. We are not seeing a heartbeat, so it means the baby has died. And you are going to start physically, your body is going to start, getting rid of everything. So the uterus starts contracting, and that's your body responding to the failed pregnancy and trying to remove everything from the body. So you will have period pain-like pains that will come and go. They will get intense. You will bleed. The bleeding may start lightly, and then eventually you have, progressive bleeding with heavy clots that will come out. And, take painkillers to help with the pain, and your warm showers to help with the backache, because a lot of ladies also verbalize backache with everything that is happening. So try and rest, rehydrate, because you are losing a lot of blood. If the blood is too much, because a lot of the times the blood gets to be excessive because the lady is bleeding so much, there's clots that come out, go to your nearest medical center as quick as possible so that they can be able to assist in that. So a lot of the times you'd be admitted into the gynae unit where assessments will be done. Some ladies actually end up needing a drip, so we put up a drip just so that we rehydrate them as well. And medication can also be given via the drip, because sometimes some women, you still have your pregnancy symptoms. It's not like your body has just shut down completely because this has happened, but you still have, your pregnancy symptoms. So some ladies will vomit, so you need to rehydrate them, give them something to stop the vomiting. Also, they cannot eat, so you need to give them something that will help keep their energies up, because they are losing a lot of blood as well. And the advice as well gets to be, when the bleeding starts, go into the hospital so that an evacuation can be done, or those products of conception can be, caught at the right time, so that they can be sent off for proper investigations. If you bleed at home, if you can put that into a container or a plastic or whatever and bring it to the hospital, so that we can see as to, what came out, and be able to take it from there. So more than anything, it's support. There's ladies that have also referred for counseling, because some people cannot deal with the process, with the fact that they've lost a pregnancy, especially those ladies that have been trying for quite some time, and then finally they are pregnant, and then they lose the pregnancy. It is a painful thing. So, counseling for both partners, so that they can be able to deal with this together.
And what do you regard as excessive bleeding, right? Because if you've never had a miscarriage before, I don't think you can really gauge, is this, because that's the thing, it's all such a shock to you, so you're not sure how much blood you're supposed to be losing in comparison to how much you are actually losing. I just know that I changed pants like 3 times while I was at home, because I'd used 3 packets of maternity pads while I was at home, because it was all happening so quickly. And I think my biggest problem, and this is awareness to other women as well, is like hydration is so important, because I blacked out on sitting on the toilet, because it got so bad that I was like, I'm not wearing any more maternity pads. And which is the thing also, just to sit on the toilet and just let it run, because I realized how much pads I was, wetting all at once. So how much bleeding is normal?
Okay, no amount of bleeding is normal. So when you are changing your second, third pad, fourth pad, that's excessive. Your normal period, you wouldn't bleed like that. So for you to be actually aware that this is now, there's something wrong and I'm actually losing the pregnancy, would be when you're going for your third, fourth pad and they are all soaked. At times you'd find you are soaking everything, including the garments that you're wearing, or you are sitting on the bed and the bed linen also gets soaked. So that's too much bleeding that you would need to be seen for, and be assessed, and proper management be taken into account.
Because Bang Chikile, when I arrived at the hospital, which hospital did I go to? Bang Chikile said, why didn't you just come in immediately? I'm like, I don't know what's happening. I had no idea, because my bathroom was draped in blood. My bed was draped in blood. And I think that's a big part of where the shame for me came from, because I was shaped I was shameful. I mean, periods are very private things, right?
Exactly.
So
true.
blood in everyone's face is really not a thing for us women. So when that was happening and I couldn't control it, even my husband had to say, it's fine, I'll clean up, because I was like, no, it's fine, let me try and do this. So if you're going through your third, fourth pad, okay, you must go find help. Basically,
yes.
It's too much.
And remember, with pregnancy comes a lot of things. Your body is working in such an amazing way that everything shuns and feeds this growing fetus. So there's a pool that goes to the uterus in terms of making sure that it is nicely, cushioned in terms of blood supply and all of that, to help the growing fetus. So when that blood gets to be quite a lot. So that is why I'm saying, when you're going for your third, fourth pad, that's hectic. Just go to the hospital so that you can be assessed.
Wow. Okay. So it seems like
We
technology
also,
again.
before you move on as well, we also need to take into consideration as well that there's ladies that also suffer from anemia, which is low blood, as it's famously known. So if you know that you are pregnant and you have low blood, please make sure that you see your gynae or your midwife as soon as possible so that you can be initiated on, iron tablets, calcium, and, all the pregnancy vitamins to help the body. Because now when you're bleeding like that and you're anemic, you pass out, you've lost a lot of blood, emergency help comes late, it could be something that turns out very drastic for the mother as well. So you want to make sure that you get medical attention as soon as possible.
Yeah, I think I experienced the same thing because I've been treated for iron deficiency before. So okay, that makes sense. So it seems like we've been getting a lot of engagement from Facebook, but my platform is not pulling these through. So I'm just gonna share some of the comments we have got. Okay, I got a lot of thumbs up with reception. Thank you. So Londi Melo said, as for me, everything was perfectly normal. I went for a scan. I was so excited. Then the scan showed the baby was not moving and there was no heartbeat. I went for a second opinion and reality kicked in. And that time I had a scan and doctor's appointment 2 weeks before that and everything was fine. The gynae confirmed that the baby had died for 48 hours now, but I had no sign of miscarriage.
That happens. That can happen quite a bit. I've experienced that a lot as well in my line of work, where someone comes in at 6 weeks and we do a scan and we are excited and there's a flicker, a heartbeat is there, and then they come back 2 weeks later and there's no heartbeat. And you, as the healthcare professional, you're sitting there, you're asking yourself, what went wrong? What happened? There was nothing, there was no signs that something like this was going to happen. And it comes as a shock for me as the healthcare professional, for the person carrying the baby as well. And a lot of the times, in cases like this, you want to give the person experiencing it time to process everything. And that is why I'm glad the lady is mentioning that they went for second opinion, so that when you're hearing it from different people, then you can say, okay, it is really happening. Sometimes you're like, nah, why are they telling me that? Let me go for a second opinion. And when two people are confirming the same thing, a lot of the times these are cases where we don't even rush to say, let's go to theater now. Go home, process it. There's options in terms of how we can do this. We can clean in the rooms, we can clean in theater. You get a chance to take the products of conception to the lab so that we can find out what happened, and we take it from there. A lot of the times people go like, I was told there's no heartbeat and I was sent home and nothing was done for me. A lot of the times I say maybe the approach to doing it was not so okay, but a lot of time when you are given that chance, it's a chance to say, let's all internalize and process what is happening, and then we can work on the next step.
Oh, okay. So I wanna check. So Nke Srobe said, stress or depression also cause miscarriage.
Okay. I can't completely say stress or depression causes that, but a lot of the times when things are not gelling right in the body. One, when you're stressed or you're depressed, you're either not eating well or you are eating unhealthy. There's many ways of dealing with stress and depression. So it also depends. A lot of the things that happens is that some people find themselves on medication and you didn't know that you were pregnant and you miscarry. So all of those things need to be taken into consideration. And that is why full history of the mother is taken on arrival. And when we find that there is a miscarriage, we want to find out everything. Are you a smoker? Do you take alcohol? are there any social issues that you're going through, like your stress, your depression, that could lead to the body not functioning at its optimum level and for this to happen.
Does age contribute? Like, do older are at more risk of miscarrying than younger people?
With age, not necessarily, Karabo, because you find your 23-year-old having a miscarriage and a 46-year-old having a miscarriage. But remember that women after the age of 35, hormonally, there's imbalances that happen. So we find that keeping the pregnancy can be a bit of a struggle. Also, being able to conceive is a struggle. So all those things are also taken into consideration when you are looking at your individuals that present with a miscarriage to say, when did it happen? At what age did it happen?
Okay. All right. So I'm checking the comments again. Mke said, thank you so much, Nurse Nonhlanhla. This is so insightful. So how long does the bleeding happen, or does that also purely depend on what kind of miscarriage you have?
Yes, Karabo, it all depends on the type of miscarriage that you are having. Some people with a missed miscarriage will not even have bleeding at all. These are the people that come in and we're like, okay, there's no heartbeat, and they are not having any bleeding because the cervix is still closed, which is the mouth of the womb, it's still closed. Your people that have a threatened miscarriage, they will have PV spotting, which is vaginal spotting, but the cervix is still closed. Whereas your complete and your inevitable miscarriage is where the cervix is completely open and everything is coming out. And those are the people that can take anything between a few minutes to 3 hours later and everything is out. Or you find that one trickles for a week or so until the actual active bleeding comes into part. So the bleeding, in terms of how long, it can take anything between a day to about 2 weeks before one can actually say, everything completely came out.
And what options, what am I right as a patient when my doctor says you had a miscarriage, and we have to go in for a sweep? It's what is it again? A DNC?
A DNC, yes.
DNC, which is a cleaning of the womb, right? What are my options if I don't want to consider that? You mentioned we can do a second, we can get a second opinion. But what if I don't want to go to a separate doctor? What are my options with the doctor that I currently have right now?
Okay, you can wait it out. So a lot of the times, some ladies would be like, can I go home, process this? And eventually what I tell them is that, remember that there will be bleeding. There might be bleeding that happens. So you can go home to internalize everything, but expect that there might be bleeding that comes. So once the bleeding has started as well, you have an option to say, do I wait it out and bleed everything out, where your gynae or your midwife will be scanning you on a regular basis to check and see if everything has come out or not. But also take into consideration that we also take things differently. And some people don't want to wait that long, dealing with this painful period, because this is a loss. And you don't want one to be experiencing it for a week to 2 weeks, going through the same thing. And there's a risk of infection as well, because remember, the mouth of the cervix is open. So you could end up getting an infection from all the products that are retained inside, with the risk and danger of, you being affected in terms of falling pregnant subsequently. And that is why a lot of the times the treatment would be, okay, you haven't started bleeding. You want to go home and internalize. Maybe this is a Friday afternoon. Come back on a Monday morning and let's assess and see if you have started bleeding or if you have not. And we take it from there in terms of whether do we go to theater or do you still want to wait it out, bearing in mind that infection is the one principle that could, ruin future, conceptions.
And are there blood tests that we can take while we're waiting it out to check if
yes,
the baby...
a lot of the times what we do is when we say there's no heartbeat. It's a missed miscarriage. There's no heartbeat. We tend to send the ladies for a beta HCG, which is a blood test that is taken to check the pregnancy levels, to say, where are we sitting? If it's dropping, then it means the pregnancy is not there. If it's increasing, then we wait to see, are we recovering, not recovering, what's going on? But a lot of the times you'll find there's a decline, and then we take further steps moving forward.
All right, cool. We've got a comment here from Rafile Mugabi. And thank you guys for engaging. Please do share your story with us. That's what we're doing here. We're trying to, get as much insight as we can, but relate that to the story that we've went through. Because I think at the end of the day, sometimes we really do go through similar stories. So your story might, touch someone else's life. So Rafilo Mikabi, okay, this is gonna hide us, but this is important. She says she had 2 miscarriages. She didn't know she was pregnant, and now I am pregnant and I constantly have abdominal cramps and light bleeding. I went to the doctor and we did the scan. It shows that the baby's fine. However, I get paranoid every time I get cramps. How can I deal with that?
Okay. In Refila's case, because she's had 2 miscarriages before, she will be categorized as high risk in terms of this pregnancy. And what the doctors normally would do, this is where, even when someone like that comes to me as a midwife, I would definitely refer them to a gynae so that they can take the necessary precautions in place. Where Refilo would be put on medication, a lot of the times they use medication called utrogestin or cyclogest to try and relax the uterine muscles so that she stops contracting. And she's given other forms of medication, to help with blood circulation, and, bed rest is encouraged so that, we can be out of the risk zone and into the safe zone.
Okay. So yeah. I'm not sure which doctor. Do you think she should seek a second opinion? Because now she went to one doctor and doctor says you're fine. What do you think she should do now? Because
if she's uncomfortable with the doctor that she's seeing, she can seek second opinion and see if the management will be different. Because remember, different people use different management approaches in terms of pregnancies. A lot of the times, I tend to say we tend to, because I have history with you, I want to stay with you and hope for the best. But sometimes if it hasn't worked before, can we try something different? Can we try someone different and see if it will work different? So I would say yes, seek second opinion and see if the management is different, and then take it from there.
Okay. All right, Rufila, I hope that's gonna help you. And because it's been something that you've experienced before, I definitely understand the anxiety that stems from that.
Yes.
Because you're well too familiar with this play. So if you are feeling uneasy, I think it's important to find a health professional that makes you feel at ease. If your doctor can't help you settle your anxiety, then maybe it's time to look for a new doctor.
Different one. That's true, Karabo.
Yeah. In case Robe asked on Facebook, what happens, this is important, what happens if someone has an ectopic pregnancy? Can you explain an ectopic pregnancy to us? And an ectopic pregnancy.
An ectopic pregnancy, an ectopic pregnancy is a pregnancy that happens in the tube. So we have the uterus, we've got the fallopian tube, we've got the ovaries. So, fertilization will happen where the sperm and ovum meet and then sucked in and goes through the tube. So this is pregnancy that will get stuck in the tube and will grow in the tube. But because the tube is not a conducive place for a pregnancy to grow, that pregnancy doesn't get very far. A lot of the people will have pain, and their pain will be more to the one side than the other. And sometimes where the ectopic actually ruptures, then these are the people that will come into a hospital unconscious because they are bleeding internally. A lot of the times, there would be signs in terms of bleeding to say there is something wrong. You will take a pregnancy test and it will come back positive. But when we scan the uterus is empty. So it means the pregnancy is there, but it's growing somewhere else. And these are cases where the gynaes would say, let's go to theater and investigate further. And those will be where you find that the pregnancy is growing in the tube.
Can an ectopic pregnancy be saved?
Can it be?
Can it be saved, or there's no way?
Unfortunately not, Karabo. Because this pregnancy is growing in an unconducive place, unfortunately it cannot be preserved. A lot of the times, mommy will lose the one tube where the pregnancy is growing.
Ooh. But if they notice early and the necessary procedures are done, we could preserve it, so
Yes.
the pregnancy could be expelled without any major effects.
Yes, if it's noted quite early, yes. But where it's noted late, unfortunately, the tube cannot be preserved.
And what are some of the major symptoms of an ectopic pregnancy? We can just run through those.
Abdominal pains, and a lot of the times vaginal bleeding.
So they go through the. Maybe let me do this. Let me see if I can share my screen quickly.
Right.
Share screen. Application window, Chrome tab. No, I want to show a picture. Why can't I show a picture? Technology, let's see quickly. Okay, now it's refusing to just share a picture. It wants to share this. So maybe let's do this. I just want, maybe we can get a visual of an ectopic pregnancy. Maybe we could. Okay, so let's see if we can help here. Come on. Can you see the screen?
It's coming on. Yes, I can see it.
So there's one here that shows, can you see the normal pregnancy and ectopic pregnancy?
Yes.
Okay. All right. So you're saying with an ectopic pregnancy, so the fertilized egg is implanted in the fallopian tube. So a baby really can't grow there.
No, it's not a conducive place. Remember, the uterus cushions up to receive a fertilized ovum. So where the endometrial layer thickens up so that it can receive that fertilized egg. So growing in the tube, and remember there's multiplication of cells all the time. So with multiplication of the cells, it will grow and expand, and in the tube where it's not conducive for it to grow.
Okay.
Then so when the pregnancy grows, yes, Karabo? I was saying as the pregnancy grows.
Yeah. No, you can continue.
Sorry. As the pregnancy grows, there's small capillaries that develop to implant and penetrate the uterine wall. So that cannot happen in the.
What's a capillary?
It's small veins. So those small veins, they develop to penetrate the uterine wall, and that cannot happen in the tube, unfortunately, so that the placenta can start growing. So because that cannot happen in the tube, that is why that pregnancy cannot continue.
Okay. And how far can an ectopic pregnancy go in terms of like gestation?
About 6-8 weeks.
Okay. All right. And when it ruptures, is it always high risk when a woman experiences a rupture?
High risk when it ruptures. It is high risk when it ruptures because you experience internal bleeding. So that is very, very, very risky. A lot of the people will come into hospital unconscious.
Yeah, I think you said I'm seeing the signs of a ruptured ectopic pregnancy. So the sudden severe abdominal or pelvic pains in the lower back, dizziness or fainting, and pain in the shoulders due to leakage of blood into abdomen, affecting diaphragm.
Yes. Yep.
Yeah, that sounds hectic. Very risky. Okay. Yeah, very hectic. I'm gonna stop screen sharing. Let me see here, Facebook, if you've got some comments. Okay, I hope everyone understood what an ectopic pregnancy is, and what happens afterwards. So it says this means automatically the pregnancy has to be terminated. Is that called abortion, or what is it called when you get rid
Which
of
one?
an ectopic pregnancy?
The ectopic. Can you repeat the question again?
So it says the termination is a requirement. We have to terminate the pregnancy that is an ectopic one. So she's asking, is it called an abortion, or what's the medical term when we get rid of an ectopic pregnancy? Is it also called a miscarriage?
It's considered a miscarriage, an ectopic pregnancy. It's not, categorized as an abortion or anything like that. Yes, we get rid of it because it's growing in a not okay place, but it's not considered an abortion. So we would mention it as yeah.
Okay. So I wanna end up here. So I've heard a lot of general perceptions from women who've miscarried and thought the medical profession is quite cold when it comes to miscarriages. The whole I went on a Friday and they said I must come back on a Monday. I mean, what are you expecting me to do in those 2 days? Do you maybe you guys have seen this too many times for there to be a human element in every case? Or do you think you are well within your rights to advise like that, dependent on the case? Are we being a bit too emotional about us expecting to get too much attention and comfort from medical professionals when we're losing a pregnancy?
Okay, Karabo. With that, it also depends on what that medical professional, what approach are they using in terms of managing the whole situation. In terms of you being told to go home on a Friday and come back on a Monday, is it because of the things that we spoke about and you want to go and process what is happening at home first for you to come back? I've had instances where we would see you on a Friday and would say, you know what, come back tomorrow. If you want to go and process and you feel you are ready tomorrow, come back tomorrow and let's take the necessary steps that we have discussed together to say this is the next step that we take. Or you can come back on a Monday. I don't think it's being cold. I think it's more giving you the opportunity to absorb what is happening, because we deal with things in a different way. If I was to have a miscarriage now and I have someone that tells me, you've miscarried, let's go to theater, and why? Have I absorbed this? Have I thought about it? Is this what I want? Are you giving me enough time to deal with my loss? Because this is my loss, as a person. So I don't think more than anything is being cold. I think it's more, do you need time? Let's give you time, and then come back when you are ready.
Yeah, I like that. I like because I like that because then you have options to consider. But then I think
Yes.
the most important thing is the approach to say,
Yes.
maybe don't just say, let's go home and I'll see you on Monday. Maybe explain to me why you want to go home. Because if there's an explanation that's attached to it, then I'll process it better. Because what I realized is I usually have questions. But in that instance, I didn't have any questions because I was so dumbfounded by the whole thing. So maybe the relationship with the health professionals that you have as well, are they giving you enough information for you to go on? But also, if you don't feel like you're getting enough information, I think it's always better to go find a second opinion from someone who will give you a lot more information in the kind of comfort that you need from the situation. We've got another. I think it's going to be our final one, a final question.
Garabo, I think before you move, can I just add something before you move on? As well, there's instances where, your healthcare professional would say, do you want us to admit you in the ward so that we can maybe give you also, things to help you cope better, give you a sleeping pill. This came as a shock, all of that. in terms of support. So it's all about the approach more than anything. And yes, as healthcare professionals, we all have, different ways of dealing with things. And the approach, the mannerism, it is what's more important when dealing with sensitive issues like that.
Yeah, it's a very sensitive issue. Mokgelo Mabizela says, "Hi, Kamo. What are the chances of having a normal pregnancy after an ectopic pregnancy?"
Oh, the chances are very high and good. We've had ladies that have one tube and they are at pregnancy number 4, number 5, and with no issues. So sometimes you find, yes, you lose that one tube, but the other tube is working perfectly normal and there's no issues, and you carry on with your pregnancies as though you don't even, you have the other tube, but it's not there.
On the point about another pregnancy, why is it so easy for medical professionals to advise you to go try again, like right after telling you that you've lost a child?
Karabo, in my line of work, I think even the people that I've worked with will tell you I've never advised a woman to do that. Because for me, as a woman, I feel it's insensitive for you to tell me to go try again. Am I even ready to have sex again when you're telling me I can go try again? What if I'm still hurting? This is a loss for me, because a miscarriage, I feel like someone has ripped off something they've stolen from you, and you need to deal with the pain and, the loss, and process everything before you can tell the lady, go try again. So I've never told anyone, go try again. Like, don't worry about it. It's like you're telling me, don't worry about it. Go try again. It doesn't work like that. This is, yes, I might have not even been ready to fall pregnant, but the fact that I was pregnant and now I've lost this pregnancy, I need time to deal with it. And don't tell me I can try again in 3 months. What if in 3 months I'm still not ready? So for me, that approach is a complete no for me personally. I do not tell anyone to go try again. I'm one that says, let's go through the journey together and let's see when we are ready to have another baby.
I love that. Thank you for that. We need that. And in a case where a woman is ready to try again, what do you medically advise them? Like, how long should they wait before the partner can penetrate?
Okay. In terms of being intimate again, it will all depend on how you feel physically in terms of you being intimate again. Some people are sexual beings. They cannot stay without, being intimate for a long time. So when you feel ready, that's the time that you should be able to do it. And but my advice as well is, when you are now ready, you can be intimate again, but when you are ready for another baby, see your medical professional so that you can plan better, so that, we can see what steps do we take in terms of, trying to make sure that something like that doesn't happen again, even though we've got no total control over it. But what are things that we can do to plan better for the next pregnancy? So having your medical checkup first, doing a pap smear as well, checking if everything is okay in terms of your cervix, just a physical check to say, am I okay? Am I taking supplements already? I started on vitamins, am I eating healthy? Am I, rehydrating okay? And all of that. And then we take it from there.
And can someone like Karabo, who, if someone wants to try again, can they come to you, or do we have to go the gynae route?
Okay. I feel like midwives are not utilized much. And we do have a pool of knowledge in terms of, managing such cases as well. But in any case, anybody that has had a previous miscarriage before, yes, they can consult a midwife, and the midwife will be there for support. But as soon as a pregnancy is established, the first route would be see your gynae, so that we can establish is the pregnancy is in the right location and all of that, and then we take it from there. And then for further, what's the right word? Further management or care, you can still see your midwife. Yes.
All right. So if the gynae determines that it's a healthy pregnancy, then I can go the midwifery-led route.
Yes, we can.
Also, I just had an idea because I resonate with what you said about midwives not being fully used. Maybe me and you should have a separate live conversation about midwifery-led care, because I think we are not understanding how beneficial it could be, and why you guys are so important. So let's do that, okay? We're gonna do that. Yay! We've birthed another. Yeah. Well, the ladies have other questions. They don't want to go, but we're serving them. So you still have some time to go?
Yes.
Okay, so Ulondi says, is it possible for me to carry full term even after miscarrying at 6 months?
Yes, it is possible. With more of a stricter care being taken into consideration. So this would be your lady that you would want to see at least every 2 weeks in their pregnancy to make sure that everything is going well. Because a lady that miscarries at 6 months, this is a lady that either has issues with the cervix. So there's cases where you have cervical incompetency, where a stitch has to be put around the cervix and all of that. So with all of that taken into consideration, depending on the events in this pregnancy, it is possible to go to full term, but sometimes you would be advised to say, you know what, we've reached our 36-week mark. Can we get the baby out? So it also depends on the circumstances around the pregnancy to say what is going on currently, what challenges are we experiencing, and then we take it from there.
Okay. So for women like that, I think it relates to what you just said. When they're finally ready to try again, then they should definitely see a medical professional to see what they could do differently than the first time.
Yes.
If I said that correctly. Okay. And then another question, how often can one go for a physical checkup before considering conceiving? Can you just go once, or does it have to be regular sessions with a professional?
Okay, I think when we're talking a physical checkup, a yearly physical checkup is important.
Mm-hmm.
So yearly, it's ideal that one goes, for a full physical every year to check and see, am I okay? Things change over time and they can change rapidly without you knowing. And once you establish that now you are pregnant, because if you've had issues before, then it's important that you see your gynae or your midwife as regularly as possible, based on, what scheduled times are put in place for this pregnancy, and then you take it from there.
I like that. I think there's another comment. Refilo says, thank you for this. Has been very insightful. I just wish men could be open about how they feel after we have the miscarriage, because they also get affected. They really, really do. The previous conversation I had was with a couple that miscarried, and we were just talking about how it affects their relationships. Maybe in future we could have one with the dad as well, that would be open to sharing the experience just from a date perspective, because they equally lost. We lost, the physically as well, but when they're involved, they also somehow attach themselves to the pregnancy and the experience. So they also lost as well. But this is what we're trying to do. We're trying to have as many conversations as we can about this, just to make it a normal part of, being on this parenting journey and trying to conceive and trying to build, to bring kids into this world. Dr. Nonhlanhla, I mean.
I receive refill. I will be doctor.
That's why I mean, what your just final words from your side? What do you wish people could just know about the subject? Any advice for moms that have went through it and are too scared to try again? What do you have?
Just to trail back to what Refilo is saying about men and them voicing out in terms of how they feel. I think sometimes as females, we get to be a little bit selfish and feel this is our thing, and I'm the person that lost, you didn't. But in cases where your partner was also ready for this pregnancy, they are at a loss too. And they also need to voice out. And it also depends on the type of relationship that you guys have. If you're open enough to share your feelings together, then he would, voice out to you. But remember, men don't want to look weak. But I always say, if you're not weak with me, who are you weak with? If you're my man and you cannot be weak with me, who do you want to be weak with? So can we be weak together so that we can strengthen each other and move on? So I think it would be quite important for us to, engage the men more. A lot of the times when, a lady goes through that, I also say sorry to daddy because he also lost. And it's a painful process for them too. The men don't cry, it doesn't work. Can we allow them to also cry out and voice out and say, yes, I have lost a child too, because that was also a part of them. And coming to talking more about this, I think this was a very good platform, and we need more, topics like this so that women out there know that it is not your fault. The one thing that I can say is that it is not your fault. A lot of the times there is nothing that you can do to control what your body is doing at that time, and it is not your fault. And it doesn't matter how long you grieve, because that is your loss. Grieve for as long as you want, but remember that you also need to get out of that space. Don't stay there for too long.
I love that. Every woman that has lost a child through pregnancy, through miscarriage, we see you. You are seen. This is why we're doing this, because I want us to feel seen, not to grieve in silence, not to grieve in loneliness, because we are feeling shame, or we're feeling guilty, we're blaming ourselves. But it's my aunt said these are growth pains, and these are some of the we go through in this path of growing and trying to bring kids into the world. So we see you, we love you, and thank you so much to everyone that joined this conversation. Let's continue the conversation. I never want my conversations to end. I want to be the conversation kickstarter, but I want us to be able to continue the conversations on different platforms within our families. Our families as well, because I think I found out I had family members that have miscarried and I didn't know anything about it. And that's been so shocking for me, and I'm just also grateful to have a platform that I can use to drive as many conversations as we possibly can. Sister Nonhlanhla, thank you so much for your time. I really appreciate it, and I will definitely I'm gonna list it, the midwifery, because I wrote an article the other day about it. Actually, people should, if when you get time, I'm going to link it on my Instagram account. I've got a Linktree account to different articles. I'm going to post the article about why women are choosing midwifery care over traditional care, because really it's such a human experience to have a midwife. Because I also went midwifery-led care, so the conversation definitely needs to happen, particularly in Black communities, because I feel like midwifery-led care is what we've been doing. We've never been able to afford gynaes, our mothers couldn't afford gynaes in this fancy treatment. So it's a beautiful way to birth children. So we'll definitely have a conversation about that, and I'm really grateful for your time. Asante, thank you so much to everyone. Cheers.
Thank you. Please. Thank you.
Cool stuff.